our clinics. Hopefully that will happen soon. I also offer the lecture in their curriculum about teledentistry. I've created continuing educations for licensed providers. In 2023, I co-authored a research project, and we were published in the Journal of Telemedicine and Telecare. And then I'm currently a teledentistry clinical consultant for another research project with a colleague that recently presented. We're trying to develop some AI technology to help develop a teledentistry app. So more to come on that. So learning objectives today, we're hoping to understand the common modalities of teledentistry, identify how some teledentistry benefits and challenges, consider how teledentistry can increase access to care, and then review how it is currently being used in the United States. So a little history of teledentistry, which, is an umbrella of telehealth. The first documented use of teledentistry was by the military, the US military in 1994. They supervised a suture removal through a video. And when they asked the 16 patients that they offered these services to, 15 of them were happy. Mostly they didn't have to drive back and forth to the bases that were a few hours away. They found that there was no post-op procedures needed. And again, no need to travel back and forth, which is a great advantage. Apple Tree Dental here in Minnesota started offering teledentistry in 2001. They were remotely supervising hygienists, the dentists were. And now today, they actually offer all of their limited exams as a triage through teledentistry. In Alaska, dental health aid therapist is another profession that was created in 2002 in order to increase access to care. It was because of the geography of how spread out everyone is, and currently they're still utilizing this profession to serve 40,000 patients annually through teledentistry. So the four modalities are, same as telehealth modalities, but these are recognized by the American Dental Association. We're going to walk through each one and how they apply to teledentistry. So synchronous, asynchronous, remote patient monitoring, and mobile health. So synchronous, like what we are doing here today, is a live video, two-way interaction between a person, patient, caregiver, provider, and a provider using an audio-visual telecommunications technology. Sometimes can be phone, even through teledentistry, which we'll talk more about. And then asynchronous, which is the store and forward modality. I put a visual here of just how it works in dentistry. So typically you'd have one of your allied dental professionals, like a hygienist, an assistant, dental therapist at a satellite office collecting intraoral photos, x-rays, charting, periodontal probing, send all of that information through an electronic health record to a dentist that can evaluate that information at a different site on a different day. They can then send that diagnosis and a treatment plan back to that team member and say, okay, go ahead and do the cleaning, or go ahead and do, something within your scope of practice. And then they can refer as needed. Remote patient monitoring is a subcategory of synchronous and asynchronous. And where I've seen it used most in dentistry is with at-home sleep apnea tests, which are used in medicine as well. But we do have dental sleep providers that can create oral appliances. And this device can measure heart rate, blood oxygen level, airflow, and take all that data and send it back to the provider that is caring for this patient. Mobile health, again, is a synchronous or asynchronous, or it's a subcategory of one of those modalities, so it doesn't have its own billing code in dentistry. An example of this is the company PH2O. So they have an app. They will send the patients a litmus test, a litmus strip, and ask the patient to put that into their mouth so they can evaluate the pH of the saliva. And then they say all you have to do is take a picture of that litmus strip, and then the app does the work for you. They can then have that information sent to their dental providers. And so then we can determine what's the best individualized care, what kind of products do they need, what kind of materials should we use in their mouth based on how acidic their saliva pH is. Another example of mobile health is the Philips Sonicare FlexCare Platinum Connected Toothbrush. It's a mouthful. And with this, patients have the ability to download the app on their phone. When they brush, they can find out if they're missing areas. They can do work on some goal setting, find out, some other uh, touch-up areas that they need, and it will tell patients when they need to change their toothbrush. They can elect to have that information sent to their dental care providers as well, and so then we can help work on goal setting with the patient. So the two CDT codes, which are the dental billing codes, were actually introduced in January 2018, even though people were utilizing teledentistry before that time. This is when it became official. And so the synchronous code is D9995 and the asynchronous code is D9996. Both of these codes are reported in addition to any other procedures that you're actually doing, so like a diagnostic exam, billed on the same day of service, just as um, a reference of mode of transmission. So Minnesota, we don't get reimbursed for these two codes. Some other states actually do have a dollar amount that reimburses for these, but for us, it's just documenting how we deliver the teledentistry. So some benefits of teledentistry. Number one, to me, is keeping patients out of the emergency room. If you're not familiar, a lot of people end up in the emergency room because they, avoid the dentist, they wait too long, and then they're in severe pain or they're swelling to the point where we can't treat them in the dental office. But there was a study from the American Dental Association Health Policy Institute that in 2016 reported $2.4 billion were spent in the emergency room for dental related care. And the difference when you get dental care in an emergency room versus in a dental clinic is pretty significant. ER cost is between $400 and $1,500 for a dental visit, whereas in our chair would cost only $90 to $200. Uh, with that study, they found that 2.4 billion was spent across 2.2 million dental visits, and 70% of them occurred outside of dental business hours. And the people that were more likely to end up in the ER were those who had Medicaid or who had no insurance. And so they predicted that if 79% of these could be shifted to a dental office, that would translate to a potential cost savings of about $1.7 billion per year. And that money could be used for so many other things. It could be funding premiums for Medicaid, preventative dental visits, oral health literacy efforts, or other more cost-effective interventions. Another benefit is, if we can receive prior information before the patient actually sits down in our chair, we can more reasonably predict what kind of treatment they're going to need. We can allocate the appropriate staff, how much time, what materials, so we can decrease our overhead costs and decrease our PPE usage, which also, if the patient is immunocompromised or if we have a surge of COVID or another airborne virus, then we can decrease exposure risk, which is always great. It also can increase access to care. And why we care about this is just in May 2025, CareQuest Institute reported that 72 million United States citizens, or 27% of the population, don't have dental insurance. And then on top of that, there are about 6,800 health professional shortage areas across the country. We feel it in the profession. We're really short on hygienists, on dental assistants, and now with baby boomers making their way out into retirement, this number is just going to increase. So offering teledentistry and where we can be in multiple places at one time can increase access for patients that have mobility issues, that have a really hard time. They can't easily just um, from like a nursing home pick up and move and go to a dental office. If they're lower socioeconomic status, it can be easier if you don't have the money to pay for gas or transportation. School-based health centers, this is a great way for families that maybe have multiple jobs and can't easily take work off and bring their kids to appointments. Dentistry can be brought to schools and to kids. Another benefit, and I know we're talking about telehealth and pediatrics today, so um, this picture I like to show to think about how a mom and her kid could be at home, and the kid could be nice and comfortable sitting in mom's lap, maybe a dog sitting in their lap, and you could offer these teledentistry exams to help decrease anxiety or the white coat syndrome and really build rapport with the kid. Especially during COVID, we had so much in dentistry, so much PPE, and so we were a little scary looking. I mean, we were kind of scary in general, but with if you can have a video visit for your initial consult where you don't have all the PPE. That might be more comfortable for the child, and then when they actually do have to come in, they know what your face looks like. Um, Big benefit for the family is that they can have less missed days of school and work. Often if dental offices are usually Monday through Friday, 8 a.m. to 5 p.m., some have expanded hours, but not always. And so, for the parents to have to take off work and then pull the kid out of school and likely not have time to bring this kid back to school. It's really nice for families. And I often get asked, how could you do dentistry over, video? And it's an enhancement of how we provide dental care because we're always going to have to, eventually physically be in someone's mouth to offer cleanings or any treatment that's needed. But we can increase patient health outcomes by providing nutrition counseling, tobacco cessation, oral health literacy and oral health instructions, brushing and flossing techniques. So there's a lot that you can do and decrease the time you're taking doing all the paperwork and going through medical history just by video. So I like, and I apologize for anyone that is a little squeamish with these photos, but I like to highlight this study that was published in the Journal of the American Dental Association in 2021. This was a study done in Brazil in a rural area where patients had a really hard time getting into the dentist and specifically were a few hours away from specialists if they needed to be referred. And so these researchers decided to see how accurate a diagnosis would be from a phone, a smartphone versus someone in person. And so they had two different pathologists that reviewed these images, or one was in person and one reviewed the images for 33 patients that were aged 25 to 83 and had 41 lesions among them. They offered a synchronous teleconsultation and then sent photos. And in 92.7% of the cases, which was a double-blind study, the diagnosis was accurate between the in-person pathologist and the teleconsultation. And so what this equated to is earlier intervention, because if we can see the lesions that look like they need a biopsy now because they might be squamous cell carcinoma versus something like a lipoma, which is more benign and could be monitored. We can really triage the people that need that life-saving, potentially life-saving care. And this is one of my favorite studies. In 2015, the Health Policy Institute from the ADA studied or did a survey of about 15,000 United States citizens, and they asked how many people plan to go to the dentist in the next year. 77% of people or adults said that they were planning to go, but only 37% ended up actually going. And then they were asked why didn't they go? And more often than not, it's cost. But people are afraid of the dentist. It's an inconvenient location or time. They have a hard time finding a dentist. And what I like is this actually broke down by state. And so I'm in Minnesota. So I'm like, why aren't people going to the dentist here? What can we do about it? Same thing, cost, but we have 6% more anxiety than the general United States. And so I don't know, we have blizzards here, ice, so I don't know if that contributes. But what I was troubled by is the hard time finding a dentist. So 28% of people who were surveyed in Minnesota had a hard time finding a dentist versus 15% across the rest of the country. We have a lot of rural areas. Anecdotally, in my position, I speak with a lot of different clinics all over the state and the Dakotas. And I hear stories that in the Bemidji area, there is no pediatric dentist that accepts Medicaid in that area. And so the closest referral source for them is a 3 hour drive. Same thing in kind of the Grand Marais, Iron Range area, Hibbing area, northeastern Minnesota. The closest oral surgeon that will accept UCare specifically, which is one of our Medicaid providers, um, there is no one that accepts UCare anymore. So they are actually referring people down to the Twin Cities, um, Fergus Falls area, kind of central Minnesota. Apple Tree Clinic there has a wait list of 2,000 patients. And so the wait lists end up being about 1 to 2 years before people can get in. So, these are things that in public health, I'm always concerned about who is not in our chair as much as we're worried about who is in our chair. And then, what are the tools? How can we help? I think teledentistry is a great idea. So, I also like to point out that, communities of color have disproportionate barriers to care. And so increasing access to care is a social justice issue, and teledentistry is just another tool in our toolbox that could help in this profession. So just highlighting two specific disparities, the Indian Health Services Oral Health Survey in 2012 found that across the United States, American Indian children had 30% more tooth decay than all other races and ethnicities, and then almost 20% more untreated tooth decay. And then Minnesota in particular, the Department of Health in 2015 did a survey that found third grade Hispanic children had nearly 20% more incidence of tooth decay compared to their white counterparts, even though Hispanic or Latino people at that time only made up 4.7% of the population compared to 85% of the population identifying as white. So just showing that disproportionate effect. And then, if you haven't heard of the case of Diamante Driver, it's really tragic. In 2007, a 12-year-old boy and his mom were trying to find a dentist because he had a toothache. Mom called 26 dentists in the Baltimore area where they lived. They finally found a dentist that accepted their Medicaid insurance after 26 calls, and they got in. The dentist gave a referral to an oral surgeon to take that tooth out. But by the time she got the appointment, it was the end of the year, so the appointment was in January. Her insurance had lapsed, and so they didn't make it in. He actually ended up being hospitalized because the infection spread to his brain, and this was showing he had to have some brain surgery, and unfortunately, he did not survive. And so, these are completely preventable issues, and I just think, could teledentistry have impacted this? Could teledentistry have at least connected mom to a dentist who could have prescribed an antibiotic as a band-aid to help get them through to that referral or to get signed up for insurance? So breaks my heart, and I just hope that we can avoid these situations. Of course, there are challenges with telehealth, teledentistry, because we're using technology. And I always point out we have a really good interpretation service at the University of Minnesota called Language Line that we use a video. And so, especially if people are using synchronous teledentistry, I remind them that they should be connected with something like Language Line where they can three-way call in someone who can help with interpretation and translation. Synchronous in particular requires adequate broadband support, but even asynchronous, and I'll show an example. If you're taking videos or photos and trying to upload them to an electronic health record, sometimes it doesn't save or you can't get on the internet. So making sure you have hotspots or some other way to get connected to the internet. Many patients do, but not all patients own smartphones or computers. And then there might be some technical literacy there. So having some support or some guidance for patients can be really great, especially older generations. Making sure if you're, especially if you're doing synchronous calls, that you're able to preserve HIPAA. No one else is in the room with you. You tell the patient, don't be in a public space unless you want everyone to hear. I find one of the hardest things is implementing a workflow and really making the time, because you heard in dentistry we're so short-staffed. We have 2,000 to 4,000 patient wait lists. So if we have this workflow that's already working, it's really hard to take the time to now implement something new. But if you do it, it really works. And so it's just that kind of finding the change champions. Um, Legislation in general, can change. We're lucky that in all 50 states, teledentistry is legal, but reimbursement can be variable. And then there's diagnostic challenges. So this is actually one of my patients. This is a 4.5-year-old that was seen at a Head Start clinic or Head Start program. And mom had reported that the kid was having some pain. Uh, the kid was also tough behavior, so didn't want to have x-rays taken, but luckily we were able to get intraoral photos. And the problem with this is I can't really do a comprehensive exam because the decay is so severe. I can't tell from this, where does it wrap around or, how severe is it? It'd be really great to have x-rays with this. However, I can do a limited exam here. I can see that there are multiple abscesses or infections due to the decay that has spread to the nerve. And so for this case, I was able to call in a prescription for an antibiotic to at least, eliminate the infections for now. And then we were able to make a referral and get that patient in the next day to a pediatric dentist. So again, this is just triage so that this kid doesn't end up in the hospital. So some other ways to overcome these challenges, these models, and I'll go a little bit further into them, is, we're paired with our team. I have collaborative practice agreements with hygienists, and I put a lot of trust in them. I know that they are educated. I have meetings with them. We calibrate. They know what I'm looking for, and I trust that they're doing their job and doing all of the screenings, oral cancer screenings that I would be doing. I ask them to write really good notes. I want really good descriptions of any lesions that they're seeing. They can't, depending on their uh, profession, they can't always diagnose, but if they can tell me, this feels a little bit sticky when I touch it with my instrument, then I have a little bit better idea of how I'm going to diagnose. Having really high quality data collection is key. If I get x-rays that have overlaps, I am not there to say, hey, please retake this. So I'm really relying on my collaborative practice hygienists and therapists to be able to analyze what is good and what's not. And then, like I said, finding other teledentistry champions who want to help you with the process change, and then strong IT partners for when undoubtedly things go wrong or you lose your Wi-Fi. So, how has teledentistry been utilized so far in the United States? Kind of going back to where we started, the exponential growth during COVID is where teledentistry really became more often used. And so DentaQuest, which is now CareQuest, did a study in November 2020 and found that after the surge of the pandemic, that 23% of dental providers that they studied were still seeing patients via telehealth. 11% of who they surveyed said they planned to use it in the near future. And more often than not, it was public health providers that were using telehealth versus private practice. They found some of the larger states, Pennsylvania, Washington, Florida, Kentucky, Arizona, were using telehealth more often, and they thought maybe at that time it was due to payment and maybe coverage policy. 2020, there was a lot of change in the legislation. There were some states that didn't allow teledentistry at all, but we have gotten to the point where every state has some teledentistry coverage now. And then the same study said, how are dentists using telehealth? And so most often, and I think this is still the case, prescribing antibiotics or medication for pain, triaging patients, facilitating referrals, and then from there, during COVID screenings, evaluating for disease risk and oral hygiene instructions. And then the CareQuest also did another study just finding out, are patients liking this? Are they willing to use it again? And in general, the majority of patients said they were overall satisfied. They felt they could speak freely with the dentist. They understood what the dentist was saying and that they would use teledentistry again and would even refer family or friends to use it. So hopefully this video works. This is just a quick 1.5 minute video. If anyone was at the GP Track conference, this was highlighted there, but I like to we show this video to all of our students just to help them see a real life example. This is Horizon Healthcare in South Dakota. So I will Hit play, see.
Hello, I'm Dr. Michelle Schultz. I'm the Chief Dental Officer with Horizon Healthcare, and we're here to talk a little bit about teledentistry and some of the exciting things that we've been doing the last couple of years since COVID hit. Teledentistry is where we have providers at one location and the examining dentist at a different location, and we use just a couple simple things. So we use our computers, just a laptop. So the dentist and the hygienist will have their laptop and they'll connect via a meeting, like a WebEx meeting or a Zoom meeting. And then the hygienist at the site with the patient will use just this intraoral camera that they'll connect to the computer. And then they'll go around tooth by tooth, showing the dentist exactly what is in the patient's mouth so that we can do a comprehensive exam for the patient. We found the teledentistry to be very beneficial for the patients and for the providers because this allows the patients to meet with the dentist the same day potentially and create a treatment plan. And so that when they come back for their next appointment, they already know what they're going to have done. With teledentistry, we've been able to increase our access to care to patients. Being in South Dakota, it's a very large rural state, and recruitment for providers is very difficult to do sometimes. And so by being able to have this basic technology, we're able to provide more access to people in all corners of the state. Hello, I'm
Okay. And I also like to show that we send our dental students to Horizon Healthcare on their clinical rotations. So, it's nice because our students may actually get to practice that in the real world. So another example of a synchronous model is the teledentist who I had mentioned before. So they are a 24/7 app that patients can it's $64 per visit to have a consultation. They log into a portal, upload their medical history, and then when I was on the other end as a provider, I had an app. I would get a notification that someone had requested a phone or a video call, and I would log in, review their medical history, and then I would start a video chat, and between 5 and 10 minutes later, I would offer either a second opinion. More often than not, it was patients who didn't have a dentist or they were camping in northern Minnesota and woke up with a swollen face, and their dentist they couldn't get into until the Monday, and so it'd be calling in a prescription for them to get them through the weekend, and then they had through the teledentist a referral source, or they would find dentists in the area or we would refer them back to their dentist to get care that they needed. And then an asynchronous model that I currently use, and for the pediatric highlight most often is helping Head Start and school-based programs, mainly teeth in Portland, Maine. They actually started just with this truck and a trailer, and this is a shot inside the trailer, so you can see it looks really pretty nice for our patients that maybe don't have another dental clinic to go to. It looks pretty similar to just a brick and mortar clinic. So it's a mobile clinic in Maine that is run by an independent practice hygienist, but if they take x-rays, then they must have a dentist review them. And so they use that asynchronous model where they gather all of the data, send it to me through an electronic health record. They send videos, which is my favorite way to do teledentistry because if I can't be there in person to touch and feel everything, at least having a video, the hygienist can tell me what they're seeing. I think I get a little bit more out of it than even just photos. And then it can be paired with x-rays. Originally, this organization actually did home visits, but they found that there was trouble with efficiency going into people's homes. But they have hygiene student rotations, they have assistants to help with them. Through their scope of practice and our collaborative practice agreement, they can start off by doing cleanings, oral hygiene instructions, silver diamine fluoride, fluoride varnish, and sealants. And so I go in and I review all of the information and then refer out to people that can, because I still have my main license and I'm in Minnesota. So I refer to people who can, in the brick and mortars, actually take care of the disease. I put a QR code in the middle. This is a really heartfelt documentary if you want to learn more about this organization. It's about a 30-minute documentary on YouTube. Highly recommend. And then I think I still have time. So I just wanted to show an example of one of the videos that would come to me. The resolution's a little different because it's in the PowerPoint, but this gives you a good idea of what I'm seeing when I'm doing these teledentistry exams.
So this is the upper right. And this is the tooth that broke, right? Mhm. Upper left. You can close a little for me. Perfect, just like that. Buckle of the upper left. We're going to anteriors. 8, 9, 7, 6, 5. And close again a little bit. And you can swallow. Open again. Lower left over here. Lower right. Stick your tongue out for me. Tongue to the roof of your mouth. And open and say ah. All right, and smile for me.
Okay, so you can see, pretty comprehensive view of the mouth. I even feel like I was there. I was listening to Elton John with them. So this is the corresponding full mouth series that they sent. And so, from what the hygienist said in the video, I can see exactly which tooth has the broken filling that the patient came in complaining about. I get a little better glimpse of some of these other issues of broken tooth over here. And so it's up to me if I feel comfortable with the information that was gathered, if I could do a comprehensive exam. This particular one, I felt it was better as a limited exam, but I was able to diagnose kind of the problem areas and then take notes on everything else I was seeing and then refer this patient especially for that tooth that was bothering him. So, some other ways that it is used across the country in New York, Finger Lakes Community Health is a federally qualified health center that works with University of Rochester Pediatric Department. And before they used teledentistry, they would refer from this federally qualified health center to University of Rochester, which is 2 hours away. The families would have to drive down, sometimes stay overnight, and then see the pediatric dentist for their consultation, drive back home, be rescheduled for another time to actually get the procedures done. Whereas now, they started using synchronous teledentistry to do consultations with the pediatric specialists. And so, through roughly 5 to 10 minute telehealth consultations, they were able to assess the child's behavior. And that's really the main thing that when they're doing consultations, it's, what is the area of concern that we need to work on, but also do we need to do sedation? Do we need to do general anesthesia? So it's, how much time, effort, and materials are we putting into this case? And so they decided to do a study to see if the outcomes were working. And out of 251 pediatric patients that conducted this live video consult, 88% of the time, the treatment recommendations were unchanged. And most often it went from they thought, oh, this kid is pretty well behaved, so we're just going to do oral sedation with some medications, and they changed it to general anesthesia. But this has been really great for both the families and for the providers. And then, I've mentioned a few times that there is legislation in all 50 states. If you want to know state by state, so just a quick guide, this is a nice reference from Mouthwatch, and I did put a QR code here, but the slides will be available. So this is just a quick view of all 50 states. And then to highlight again Minnesota, because that's where I am, this is from the Department of Health and Human Services. And so these are all of the codes that are allowed to be reimbursed through teledentistry. And they have a note, the patient should be in Minnesota, but if the patient is going to travel or be outside of Minnesota, they have to have a authorization ahead of time. But especially through Medicaid, we can bill for all of these and then just add the modality code of whether it's synchronous or asynchronous. And then I like to highlight again, I'm not being paid by Mouthwatch, but this is my favorite tool. It's really the number one tool. This is the video that you saw was taken on a Mouthwatch camera. Um, we previously were using this at the University of Minnesota. We're switching because we had some, there was our electronic health record wasn't talking very well to the software. But for the cost, I think this one's pretty great. I also know in Montana, they are using these cameras in nursing programs. So they're teaching, medical providers how to use these so that they can, during their well child exams, take images and send it to the dentist. So pretty reasonably priced and my favorite intraoral camera. What I caution is, this is going back to how you can overcome the challenges, is making sure that you're taking high quality data and training people that, you really need good images. And so, comparing the left to the right, on the left, I can't tell what's going on this tooth. There's too much saliva, the angle is off. Whereas this one that is about an inch above the tooth, straight shot, dry field with just the right amount of light is a really nice way for me to have a more accurate diagnosis. And then there are a lot of creative ways, and I think people are developing even more ways on how we can use cutting edge technology. Uh, this is a 3D scanner that we use in dentistry that can show, it's actually a really nice patient education tool because you can show them, this is everything I'm seeing in your mouth. We can save it for if they break a tooth. We use this if we're making crowns or other prosthetic devices. And so if I was just given the x-ray on the right, I really can't tell if those translucent areas are fillings, if they are cavities. But when I have this paired with the 3D scan, I can see, oh, these are old filling materials. This is old composite. And so it's nice. I have more trust in the diagnosis. And again, in Minnesota, dental assistants, even unlicensed dental assistants, can do a 3D scan. And so you can really use your um, allied professionals to the top of their scope to help gather more information. So the future of teledentistry, I've shared how it already has worked. I think there's a lot of different ways to be creative and continue to use it in an efficient way. And so some ways that it could look is there could be in a brick and mortar dental office, one operatory that is really just a room that has a computer monitor and a video technology. We could train our staff to be the intake, and so they could have the patient go into the waiting room, review all of their medical history, and then tee it up for the dentist to come in and then do the video visit as just a whole additional chair, and they could do that in between the procedures that they're doing. New patient exams could be offered fully virtual, or it could be an option for patients. And I think that is a great way for all those patients that have dental anxiety to feel more comfortable, at least getting in the door, getting some information. Um, there's a lot of people that will make appointments and then they get scared and they cancel them. And so building that rapport through a video when people are comfortable, I think will increase the likelihood they step foot in your office. There could be more satellite clinics like the video where Dr. Schultz was saying in Horizon Healthcare. Now, they have multiple practices across the state, but they don't have dentists at all of those clinics. And so having satellite clinics where then you can utilize teledentistry, you can maximize where you can be geographically. If you want to get into more alternative models of care, the mainly teeth model that I mentioned, I actually adapted that to use in the Walker Methodist nursing home facilities. And so I had a hygienist that was going in, taking all that information, sending it back to me. And then more often than not, we were screening for infections and then working with the primary care providers to give antibiotics. But again, baby boomers are going to be making their way. We're going to have a surge in nursing homes, and we need more dental care getting to those people. Interprofessional communication has a lot of potential. I have heard of some pilot programs in emergency rooms where they have an iPad on a cart, and then they can video in a dentist when those people that undoubtedly end up in the emergency room because of dental pain, then rather than saying, here's an antibiotic, go see a dentist, you can actually talk to a dentist right then and there and then get referred in for the treatment. Like I said, wellness checks, there's, a lot of options to get a dentist connected through teledentistry. For any dentists on the call, any post-ops that are really quick that may not actually need to be seen in the office, clear aligner delivery like Invisalign, sometimes those appointments are so quick we just check to snap in the aligner and see if it fits, and we could actually mail the aligners to a patient, have them show us the try-in over video, and then that could save some chair time. So that could be made virtual. And then hopefully we don't have future pandemics, but if we do, or natural disasters, with all the fires and flood, and even for us, blizzards or what have you, we need to have ways so that we don't have to disrupt patient care. We can have that continuity of care, and having a system already set up like teledentistry is a way to do that. And then there's more and more AI-aided diagnostic tools that are coming out. For example, in dentistry, there's a couple software companies called Pearl or Overjet that you can input X-rays into, and the computer will say, this looks like a cavity, this looks like bone loss. And so we can feel more confident as the diagnosing providers to say, okay, since I'm not there in person, this tool is helping me see something that, maybe otherwise would have been missed. So I think it's going to be more comfortable to offer teledentistry moving forward. So in summary, teledentistry is a cutting-edge means of delivering care. It is part of the future, and it can increase access to dental care and health equity. As a provider, you need to weigh the benefits and challenges and decide if it's something that you want to offer. And using intraoral cameras and team-based care are the integral tools in order to offer teledentistry, but proper use and communication are necessary in order to deliver that remote diagnosis. And then I have a resource page for anyone that isn't doing teledentistry, wants to start utilizing teledentistry. If you just want more information, there's a lot of really great guides on policy or technical support, how to actually get started. So I'm happy to also connect, but we can screenshot this. The slides will be available. These are some things that I have found to have been helpful. And then lastly, my email. I'm always happy to talk or share ideas. If you want to talk about my cute dog here, who hopefully you didn't hear barking. She's upstairs barking right now. So please feel free to reach out to me, and I will stop sharing my screen so we can go to any questions.
Dr. Hastings, thank you so much. Please know I don't have any questions listed in the tab yet, but if you have a question and you would like to either put it in the tab, that's great. If you would like to ask it live, just let me know, and I can activate your voice, your audio. So we'll pause just for a moment. It was a lot of great information, and being married to one of those people who is a little bit concerned about going to the dentist, I could see a lot of value to that initial introduction. I think whether it's an adult or a child, I think that certainly provides a lot, at least a level of, it's like, oh, that's who this is. Okay, so this is a real person, and they talked to me really nice, and that's helpful. So yeah.
Yeah, one thing I forgot to mention too is, there's a lot of dental anxiety, but what specific is causing the anxiety? Is it the cost? Is it the noise of the drill? There's a lot of things that scare people, could be past trauma. So to be able to say, oh, okay, the noise of the drill scares you, well, I can then schedule you in a room that's with a closed door, so you're not hearing everyone else's drill when we're doing the exam. So, I mean, there's a lot of ways to facilitate that, individualized care.
Wonderful. We have a question. Oh, more from Sarah. She goes, I may have missed this, but do you integrate virtual child life into these visits?
You know, I don't because I actually virtual child life is new to me. So I'm unfamiliar with that program.
All right. Well, maybe Sarah can share a little more about that. Sarah, if you would like,
Yeah,
she says we should talk.
yeah, definitely.
Doc, Dr. Ash is in Minnesota as well, so that will be a potential future opportunity. And Dr. Ash is planning to, at this point, is planning to do our final um, pediatric topic in September. So there may be some opportunity for some collaboration going down the
Yeah,
path
well,
here.
hopefully I can make it to that webinar too.
Yeah, great, great. Any other questions for you?
I would say if I don't have questions, that means that I told you everything you need to know very clearly. So that's always a good sign.
And if not, then you've got her contact at the end of the slides. So thank you so much for your presentation today, Dr. Hastings. Really appreciate it. Thank you all for joining us today. Just a reminder for folks, the next topic is on pediatrics is in early hearing detection and intervention. It is July 22nd, same time. So we will hope to have you all join us there in July. And if you have any questions, please reach out to myself or to Dr. Hastings, and we will attempt to get them taken care of. So thank you again, and we'll see you all soon. Thank you.